The facts are, in Louisiana, we are in the bottom 5 out of the 50 states of our country on maternal and infant morbidity and mortality. So that is death and sickness related to the event of being born and giving birth. And you can look at food insecurity, you can look at poverty, you can look at education level, you can look at finances, but bottom line, if you identify as a Black, African American, Hispanic, or Latino person in our community in Louisiana, then you are 4 times more likely to be counted among the people who died or were sick related to their birth.
The whole process of before I gave birth, sitting down and creating a birthing plan with my doula team, I felt like every mom deserved that. I hear so many horror stories with giving birth and epidural and hospital births that it gave me a sense of peace, and it actually helped me advocate for myself, and that was a game changer.
Mary's Hands Network is a nonprofit dedicated to empowering women, bridging the health equity gap, and promoting birth excellence. We do that by training community members to be volunteer doulas, and in turn for free training, they come back and serve on our network, and then we serve moms in our communities using those doulas in our network. So we train our volunteers and we connect them with moms.
Doulas are non-medical birth professionals, which is why they're such a wonderful addition to the birth team. A doula is focused on comfort measures, is focused primarily on helping your body continue to move even just a little bit, even if you're in the bed the entire time, because every movement is helping your baby shift and wiggle and have a more efficient and quicker labor.
Good job, Mama.
We primarily focus on the comfort measures and equip you with information about different interventions and allow you to educate yourself on what a hospital is going to offer you and what your options are as a mom and as a patient.
Your child is a reflection of what that experience looked like. And if it was traumatic, your child will feel that. If it's coming into the world in a safe, secure, and happy environment, your child will feel that. And I think every child deserves a good start in life.
A lot of people think that doulas are for either like high class people or if you're only having a natural birth, when we provide services to all women who want an extra hand and an extra heart in the delivery room with her. We provide free services to everybody in the community, regardless of who you are or what you do or what kind of money you make. We're there for you. We're there for all of it, and it's super cool to see.
Helping women give birth, that's not what we're doing. We are helping women remember that they have a voice, and that through this experience, they will uplift their voice and we will uplift their voice. But in the future, the hope is that they're gonna look back and say, I stood up for myself, I educated myself, I informed myself, and why can't I do that again?
Any mom who sees our pamphlet is gonna see oh, there are people in my community who care about people like me. Every time somebody goes a further step to go to the website or go all the way to putting in an application for services. By doing that, they're already taking a step for empowerment. They're taking something for themselves. They are reaching out and saying I want to be empowered through this experience. I want change, I want more.
I think that's the reason why we do this, right? The goal is really to have a mom be informed, for her to go through labor experience, and even though it may not be what she had initially planned, to be able to look back on her birth and say, this was my birth story, and the end goal was a healthy mom and a healthy baby, and we were able to get there. I feel like we made an impact in this story. It's a new chapter for their family.